I'm Bridget-Holstein, and I'm going to be performing a full head-to-toe assessment today. First, I would start by providing privacy for the patient and performing hand hygiene. Hi, I'm Bridget. I'm going to be your nurse today. I'm here to perform just a routine head-to-toe assessment. It's going to take about 30 minutes. Is that okay?
Sure.
Perfect. First, can I get your name and date of birth?
Sure. It's Ed Holstein, 10/25/59.
Perfect. Thank you. And do you have any allergies that you're aware of?
No.
No? Are you in any pain right now?
No.
No? Perfect. Patient is showing no signs of acute distress. Can you tell me what day it is?
Sunday.
Can you tell me where you are?
In the clinic.
Can you tell me why you're here?
Just for an assessment.
Can you tell me who the president is?
Donald Trump.
Patient is alert and oriented ×4. Facial expression is appropriate to the situation. Mood and affect are appropriate to the situation. And speech is clear. I'm going to start with the skin and then go from head to toe. First, with the skin, I notice the color is appropriate to ethnicity. No wounds, lesions, or incisions noted. Nails are pink in color. No clubbing noted. No deformities in the shape or contour. Capillary refill is less than 2 seconds, and the skin is warm in temperature. For the head, I noticed all the facial features are symmetrical. For the hair, no lesions or infestations noted. Now for the head, I'm going to assess cranial nerve 5, which is the trigeminal nerve. First, for the motor function, can you just clench your jaw real quick? Okay, the motor function of cranial nerve 5 is intact. And okay, now if you can close your eyes and tell me when you feel something.
Now.
Okay, sensory function of cranial nerve 5, the trigeminal nerve, is intact as well. Can you smile for me real quick? Can you frown? No? Okay, facial nerve, cranial nerve 7 is intact. For cranial nerve 11, the spinal accessory nerve, can you shrug your shoulders real quick? Okay, can you rotate your head bilaterally? Okay, cranial nerve 11, the spinal accessory nerve, is intact. Okay, for the eyes, I notice there is no redness or a discharge noted. The conjunctiva is pink and moist, and the sclera is white and moist. Now I'm just going to shine the light in the patient's pupils real quick. Okay. And if you could just follow my pen real quick. Okay. So, patient's eyes were 2 millimeters in size. They were equal, round, and reactive to light with accommodation, testing for PERLA. And now I'm going to test cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens cranial nerves. And I'm going to do that by testing the 6 cardinal fields of gaze. Okay, if you can just follow my pen. Keeping the pen about 12 to 14 inches away from the patient's face. Okay, cranial nerves 3, 4, and 6 are intact. Okay. Now for the ears, I notice there is no discharge discharge on either ear. And testing cranial nerve 8, the vestibular cochlear nerve. This is testing for the patient's hearing. And okay, I'm going to stand a couple feet behind you, and you tell me when you hear me whisper, okay?
Okay. Testing.
Okay. Cranial nerve 8, the vestibular cochlear nerve, is intact. Okay. For the nose, I notice there is no asymmetry, deformity, or inflammation noted. No drainage is present, And okay, can you include one nostril? Breathe out the other. Okay, patient has full bilateral patency in the nose. Okay, for the mouth, could you just open your mouth real quick? Okay, lips are pink and moist, I noticed. Tongue is pink and moist, and the gums are pink and moist as well. Okay, so now I'm going to test for cranial nerves 9 and 10, the glossopharyngeal and the vagus nerve. In real life, we'd use a tongue depressor, but we're going to pretend today. Okay. Okay, I'm going to stick this in. Can you say ah? Okay. As patient saying ah, I see the uvula goes up and down, and if we stick this back farther, that would be tested for a gag reflex. And this would also mean that cranial nerve 10 is intact because the swallowing reflex would be intact as well, and the patient can talk to me without any hoarseness. Okay. For cranial nerve 12, the hypoglossal cranial nerve, can you stick out your tongue and wiggle it real quick? Okay. And now can you just do it downwards? Okay. I noticed the tongue is midline and there's no deviation in the tongue, so cranial nerve 12, the hypoglossal nerve is intact. Okay. So, beginning with the respiratory assessment now. First, I noticed that there is no accessory muscle use in the patient's breathing. Okay. Now I'm going to listen to the breath sounds start with the anterior part of the chest, and I'm going to listen with the diaphragm. Okay, I'm going to start, and normally we would do this over bare skin, but we're not going to worry about that today. Okay, I'm going to start in the second intercostal space, right upper lobe, left upper lobe. I'm going to move down to the fourth intercostal space, right middle lobe. And on this side, it's still the left upper lobe because remember the right has 3 lobes and the left has 2 lobes. Down a little more. Okay, I'm going to go mid-axillary and right lower lobe. And left lower lobe. Okay. No adventitious breath sounds were heard in the anterior portion of the chest. Okay. Now I'm going to move to the posterior. And for the posterior, I'm going to start where the portion of the spine where it's called T3, the thoracic lumbar or thoracic spine T3. Okay. Left upper lobe, right upper lobe, and I'm just going to inch my way down until we get to T10. Right, left lower lobe. And right lower lobe. Okay. Now I'm going to do no adventitious breath sounds were heard in the posterior chest. Now I'm going to do the lateral side breath sounds. Okay. Right upper lobe, right middle lobe, right lower lobe. Left upper lobe. Left lower lobe. Okay, no adventitious breath sounds were heard on the lateral sides as well. Okay. Now for the cardiac, I'm going to begin by palpating the carotid pulses. And I'm going to palpate this one side for 30 seconds. Okay, so the rate on this side was 80, rhythm was normal, strength was +2. Now I'm going to move on to the other side. And you always want to make sure for the carotid pulses that you assess one at a time. Never do it both together. That can be very harmful. Okay, rate was 80 on this side, rhythm was regular, strength was +2, so that means they were equal on both sides. Okay, so now if you could just lean back and kind of tilt your head that way actually. Okay, so first I noticed there's no jugular vein distension. You can tilt your head that way. Okay, no jugular vein distension on either side of the neck. No edema is noted anywhere throughout the body. Okay, now I'm gonna listen to heart sounds. And again, we would normally do this over bare skin, but we're not gonna worry about that today. And I'm gonna begin by listening with the diaphragm. Aortic valve, second intercostal space, right sternal border. Pulmonic valve, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid valve, fourth intercostal space, left sternal border. Mitral valve, fifth intercostal space, mid-clavicular line. Okay, no murmurs were heard when listening with the diaphragm. Now I'm going to listen with the bell. Aortic valve, second intercostal space, right sternal border. Pulmonic valve, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid valve, fourth intercostal space, left sternal border. Mitral valve, fifth intercostal space, mid-clavicular line. Okay, no heart murmurs were noted upon auscultation with the bell as well. Okay, so now I'm going to palpate the patient's radial pulses for 30 seconds. And these pulses, you can palpate together. They don't have to be palpated one at a time like the carotids do. Okay. For both sides, the rate was 80. The rhythm was regular. The strength was +2, which means they are equal on both sides. Okay. Now I'm going to palpate the dorsalis pedis pulse for 30 seconds. Okay, so for both pulses, the rate was again 80. The rhythm was regular. The strength was +2, so they are equal on both sides. Now I'm going to palpate the posterior tibial pulses, and I can palpate those together as well. Okay, the rate for both posterior tibial pulses was 80. The strength was +2. The rhythm was regular, which means they're equal on both sides. Okay, can you lay down for me? And once again, we do this abdominal assessment with bare skin, but again, we're not going to worry about that today. First, with the abdomen, I notice that it is symmetrical with the body, and the contour is flat. No caving in or protruding is happening. So now I'm just going to listen to the vowel sounds in all 4 quadrants. And I'm going to begin with the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Okay. Vowel sounds are present and reactive in all 4 quadrants. So now I'm going to palpate all 4 quadrants. Okay, is there any pain there?
No.
No? Any pain there?
No.
Perfect. Any pain there?
No.
Okay. Any pain there?
No.
All right. So no tenderness or distension is noted anywhere in the abdomen. All right, you can stand up. Okay. Okay, so for the upper extremities, first thing I notice is that there is no deformities or muscle atrophy in the contour of the upper extremities, and both the upper extremities are symmetrical bilaterally. Both bilaterally. And for the lower extremities, I again notice that they are both symmetrical. No deformities in the contour or muscle atrophy is present bilaterally for both sides. Okay. Okay. So for now we're gonna do range of motion. Okay, can you lift? Okay, and then flex your wrists. Okay, can you put your arms behind your back? Okay, patient has full range of motion in the elbows, the wrists, and all throughout the arms bilaterally on in the both the sides of the upper extremities bilaterally. Okay, and can you stand up for a second? Okay, stand to the side. Okay, just follow my lead. Can you lift up your foot? Flex your foot. Okay, very cool. All right, and bring it back. Okay, bring it up. Move it to the side. Okay, and we're going to do the same thing with the other leg. Up, flex your foot. Okay, bring it down, bring it back. Okay, bring it up to the side. Okay, bring it down. All right, so patient has full range of motion in the knees, the ankles, and all throughout the lower extremities bilaterally for both sides. Okay, if you can sit back down for me. Okay, now I'm going to test for the sensory function of the lower extremities. Okay, first, this is dull, and this is sharp. And if you can close your eyes, I want you to tell me what you feel.
Dull. Dull. Sharp. 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 Sharp.
Okay, so patient has full sensory function throughout the lower extremities. Okay, so now testing for muscle strength. Here, can you squeeze my hands real quick? Okay, and now I want you to just flex like this. Okay, now don't let me push in your arms. Okay, and don't let me pull. Okay, okay, so patient has +5 muscle strength in the upper extremities, full range of motion against gravity with full resistance. Okay, now moving on to the lower extremities. Okay, I'm going to do your feet. Okay, don't let me push on your foot. Okay. Don't let me push. Okay. Don't let me push on your leg. Okay. Don't let me push on your leg. Okay. Don't let me pull. Don't let me pull. Okay. Patient has +5 muscle strength, full range of motion, against gravity with full resistance. All throughout the lower extremities. Okay, if you could stand up for me. Okay, if you could just walk to me heel to toe. Okay, that. If you could just stand there with your eyes closed for a second. Okay, that's a negative Roberts test, so patient has full and steady gait all throughout his body while standing and walking. Okay, all right, well, after doing this assessment, are you having any pain right now? No? Wonderful. Okay, and we would also fix the patient's bed and give them the call light. Here. And the bed needs to be in lowest position, locked, and the side rails need to be up. Here is your call it. You call me if you need anything, okay?
Okay.
All right, thank you for your time.
Thank you.
And I performed hand hygiene.